What is the Agnes usable for peripheral interventions?
We use it for peripheral interventions, we use it for EP procedures, we use it for structural heart procedures. So it's used across the spectrum. And that's why we're investigating this in different subsets. This is for coronary interventions. There are challenges related to structural heart interventions when you have imagers on the left side of the table. There are challenges related to EP procedures where they are accessing actually the pacemakers, etc. They're in the different positions relative to us. So I think it needs to be investigated, but we do have 2 peripheral guys that do these procedures routinely with the ECMOs.
Do you have any comparison data compared to, let's say, for example, Rampart, Protegea, or other radiation protection systems?
No, in this study design, our control arm was standard shielding and standard lead. This is not a device versus device comparison.
Can you provide a little more detail between the difference between the Protect and the Complete? I didn't understand the reason to have only Protect and not the Complete.
There are 2 generations, the same technology. The main differences with the Complete is that there is a lead that comes down from the ceiling and is significantly wider than the version that you get with the Protect. So the Protect is relatively easy to install in a cath lab. The Complete version, you might have to modify the ceiling because it's so heavy that it needs to be accommodated. But it's essentially a 1 millimeter thick shield that comes from the ceiling and is relatively very, very wide. And so it's in my mind, the best system to protect everybody.
And there are no disposables with this?
There are disposables that come with both versions of this. So there is a blanket that sits on the patient, and there are disposables that we put at the level of access site.
How is the adoption in your hospital? How many operators do you have, and do all of them use it 100%? Or
We use it initially. We tried all the systems. This is the one that came on top, voted by physicians, residents, and nurses, and X-ray techs. We put 2, and then within a year, we have it in every single room. Then electrophysiologists wanted to have them too, so now we have it in every single room in our hospital. We have 7 cath labs and 4 EP labs and 1 hybrid room for structural procedures, and they all have the system.
And is everybody going lead-free now?
Yes, that's a very personal decision, and I purposely stay away from that because I think we want to provide numbers for people to make those decisions. So a 65 interventional cardiologist may want to go lead-free. A 26-year-old nurse who is pregnant may want to wear light lead. I think that is a very personal decision, but these numbers will suggest that yes, you can completely go lead-free and perform over 55,000 interventions in your lifetime with Complete, about 25,000 with Protect. So.
Thank you very much, Dr. Garcia, for a wonderful presentation. We'll go on to the next presentation.